Hi, I am Dr. Thomas Scotton's avatar. These lectures have been created and reviewed by Dr. Scotton, but they are for educational and informational purposes only. This does not constitute medical advice, therapy, diagnosis, or treatment recommendations. All caregiving decisions should be made in consultation with qualified healthcare professionals. Welcome to Lesson 8 of the Family Caregiving Program, Bathing, Dressing, and Personal Hygiene. Personal care is never merely a list of tasks. It is close, private care involving a person's body, identity, habits, and sense of self. The way we help can communicate respect or unintended hurry. Our guiding principle is simple. Do with the person, not to the person. Ask permission. Explain before touching. Offer real choices. Let's pause for a moment. Think about a recent caregiving task. How did you balance getting the task done with respecting your loved one's independence? Take a moment to reflect on your experience. Pause the video if you need more time. When you're ready, let's look at how safety and preparation go hand in hand. Encourage the older adult to do every part they can do safely. Assistance should fill the gap. It should not erase independence. Before beginning, review the person's usual routine and any instructions from their clinical team. Safety is paramount. Ask, is a shower, tub, or bed bath safest today? Does the person have transfer restrictions, oxygen tubing, or wound dressing? Gather everything before the person undresses. Washcloths, towels, mild cleanser, warm water, clean clothing, and grooming supplies. Perform hand hygiene before care and again afterward. Gloves do not replace clean hands. Change gloves when moving from a contaminated task. Prepare the room. Close the door and window coverings. Warm the room. Remove clutter and use non-slip surfaces and grab bars. Check the water with the person. The temperature that feels comfortable to you may feel too hot or too cold to them. Use warm water. Then ask permission. Would now be a good time to wash up? Explain the plan and invite preferences. Consent is ongoing. If the person becomes frightened, angry, or asks you to stop, pause, cover them, and reassess. Never leave them alone in the bath. Bathing may be a shower, tub bath, sink wash, or bed bath. The safest method is the one matched to the person's current abilities. Start by offering the person the washcloth. Use one-step prompts like, please wash your face. Do not rush in and take over. Work from cleaner areas toward dirtier areas. Face to feet, front to back. Use a clean section of the cloth as needed. Expose only the area being washed. Keep the rest of the body covered. Wash gently and pat dry rather than scrubbing. Avoid putting lotion between the toes. If moisturizer is part of the plan, apply it gently to dry skin, never over an open wound. Perineal care deserves special attention. Explain what you are about to do, provide maximum privacy, and use gloves. Clean from the urinary opening toward the anus front to back. Use a clean part of the cloth for each stroke. Clean the buttocks last. Bathing and dressing provide a valuable opportunity to notice changes. Look for redness, swelling, or open areas without being invasive. Pay particular attention to skin folds and bony areas such as the heels, hips, tailbone, elbows, and shoulder blades. On darker skin, pressure-related damage may appear purple, blue, or gray rather than bright red. The area may feel firmer or warmer. Do not massage a reddened or suspicious pressure area. Protect the area from further pressure and report it to the nurse promptly. Fever, rapidly spreading redness, or confusion require urgent medical advice. Call emergency services for severe symptoms. When communicating, describe what you observed: location, size, color, and warmth. Avoid clinical labels like stage 1. When you report a skin change, Be as specific as possible. Mention the exact location, estimated size, and the color you observed. Avoid clinical labels like stage 1 unless you are a qualified clinician. Simply describe what you actually see to the care team. Let's practice observation. If you noticed a new change in skin color today, how would you describe it to a nurse using the details we just covered? Take a moment to reflect on how you would describe these changes. Pause the video if you need more time. Clear communication ensures your loved one gets the right care at the right time. Now, let's talk about grooming. Grooming is deeply personal. Ask how the person prefers to wear their hair and facial hair. Do not assume preferences based on age. Before shaving, ask which razor the person uses. An electric razor may reduce cuts, but isn't always appropriate for every skin type. For a manual razor, soften facial hair with warm water and shave gently in the direction of hair growth. Never shave over a mole. For hair care, work slowly from the ends toward the scalp. Nail care for those with diabetes requires professional help. Dressing while preserving independence begins with choice. Ask, would you like the blue shirt or the green shirt? To reduce overload, adaptive clothing like elastic waistbands and Velcro closures can support independence. Ensure clothing fits well and isn't a tripping hazard. Have the person sit securely. Arrange clothes in the order they will be put on. Give one cue at a time and allow extra time. For one-sided weakness, follow the weak side in first, strong side out first approach. Never pull on an arm or force a joint. Finish by asking, are you comfortable? Check that clothing is not twisted and the person has their glasses or hearing aids. What if the person refuses? First, respect the refusal and look for the reason. They may be cold, in pain, or embarrassed. Finally, always check that the person has their preferred glasses, hearing aids, jewelry, or cultural and spiritual items. Their appearance belongs to them. These items are not just accessories, they are part of the person's identity and comfort. Never overlook their importance in personal care. Pause and ask, what would make this more comfortable? Offer a different time, familiar music, or help from a preferred caregiver. Never shame, threaten, argue, or force routine personal care. If hygiene is urgently needed, contact a health professional for a plan. For a person living with dementia, keep language simple. Preserve the routine and redirect rather than debate. Remember the dignity check. Before touching, ask. Before exposing, cover. Before taking over, wait. Before continuing, pause. Caregiving isn't always easy. If your loved one refuses care tomorrow, what's one comfort strategy you're most likely to try first? Take a moment to reflect on your approach. Pause the video if you need more time. Empathy turns a task into a partnership. Let's wrap up with a final check of our key lessons. Let's finish with 5 quick questions to reinforce what we've learned today. Question 1. True or false? Gloves replace hand hygiene. The answer is false. Clean hands are always needed. Question 2. What does face to feet, front to back mean? It means beginning with cleaner areas and moving toward dirtier areas. Question 3. You notice a dark, warm, tender area on the heel. Should you massage it? No. Report it to the provider. Question 4. The person can wash their face, but slowly. What should you do? Provide time, cues, and only the help needed. Question 5. The person says, stop. I don't want a bath. The first response is to stop, cover, and explore their concern. Remember our 4 takeaways: clean, cleaner to dirtier, encourage independence, observe the skin, and protect privacy. Personal care is where dignity becomes visible. Slow down, ask permission, and make every step a partnership. Thank you. Don't forget to download your lesson workbook. Next time, we'll discuss oral care and feeding. See you then. Caregiving is a journey of small, meaningful moments. By focusing on dignity today, you are providing the highest form of respect and love. Please consult your healthcare provider for any caregiving decisions. This video is for educational purposes only. Thank you for watching and for all you do for your loved ones. This concludes our session on hygiene and dignity. We look forward to seeing you in the next lesson.